This is Dr. Effinger. I'm just going to review some post-op instructions following your recent surgery, whether that's an extraction or bone grafting or anything of that nature. With an extraction, we will have sent home some written instructions and some gauze. Gauze is to be used if there's any continuous bleeding or oozing from the socket. Some is to be expected. Just like a wound anywhere else in the body, to stop bleeding, it's pressure and time. So take a piece of that gauze, fold it over, bite down pressure for about 20 minutes, and then check the gauze. If it's blood soaked, you can swap it out for a new piece of gauze. Some people will bite down on a damp black or green tea bag. There are some supposedly some natural chemicals in the tea that helps with that. It's a little bitter for my taste, but some patients have said that they prefer that. If you run out of gauze or don't have any tea bags laying around, paper towels can work, but again, the concept is pressure with time is what controls bleeding. We will have discussed not to perform any strenuous activity. The main reason for that is because we don't want to elevate your blood pressure too much. If you're bending over and lifting heavy things, it can cause the extraction site to bleed or ooze. Again, do expect some bleeding or oozing for several days, but a lot of bleeding is not normal. If you're unable to get the bleeding under control after a couple rounds of gauze, do give the office a call. There's an after-hours emergency line that will put you in touch with a doctor as well. As we reviewed, some of the precautions you need to take is to avoid steaming hot foods for the first 3 to 4 days after an extraction. The food can be warm. We often recommend things like scrambled eggs or mashed potatoes after extractions, but we don't want them piping hot. Anything that is super hot will loosen up the blood clot, and that can cause the blood clot to fall out of the socket. And that it's not dangerous, it's just painful. That's what's known as a dry socket. It exposes the bone to air. If that happens, give the office a call and we can pack it with some medicated packing. The other common thing that people do that they may forget when we go over this is they'll drink their favorite iced beverage through a straw, or they'll smoke or anything of that nature. Anything that causes negative pressure, like a drawing motion, can pop the blood clot out of the socket. Again, like we talked about, that exposes bone to air. It's not dangerous, it's just painful. It's commonly known as a dry socket. We can medicate that, just let us know.